All right. Welcome to the last speaker as part of the Summer 2023 Kim Love Speaker Series. My name is Andy Kim, and today I'll be introducing our last speaker, Bobbie Benavides. Bobbie is a PhD candidate at the Department of Anthropology at Northwestern, and Bobbie's research broadly focuses on population genetics and the developmental origins of health and disease framework. She's interested in understanding how political, economic systems and environmental stressors impact biological processes that are inherited by the next generation and widen disparities in health. So turn it over to Bobbie. Welcome.
Hi. Sorry, my throat is a little scratchy. So a little bit about myself. I just defended my prospectus. So apologies if there aren't a ton of findings. I just got back from the field like a couple of weeks ago. This presentation is titled Redefining Maya Health, Indigenous Ecological Knowledge and Metabolic Disease. And oh, it's not going next. Oh, there we go. So I am at Northwestern University, and I really think it's important that we acknowledge that the Northwestern campus sits on the original homelands of the Council of Three Fires, the Ojibwe, Potawatomi, and Odawa tribes, as well as the Menominee, Niami, and Ho-Chunk nations. I think Northwestern has a responsibility to recognize the violence that has occurred at this campus, namely with John Evans, the founder of Evanston and Northwestern, who funded the genocide of Cheyenne and Arapaho nations. And also acknowledge the current ongoing racism that occurs on campus towards Indigenous students and just generally towards non-white, non-traditional students. And so I wanted to kind of, for those who didn't know, there's been an issue of during Native American Heritage Month, students will paint the rock, they will express kind of support for missing, murdered Indigenous women and Two-Spirit folks, and that has repeatedly been painted over with other racist kind of statements. And so I think it's important that as students, not only at Northwestern University, but at our respective institutions, to be aware of kind of the issues that are surrounding racism and violence towards these certain communities. Okay, so this is just a quick overview of what I'll be talking about today. I will get into quite a bit and try and get through it as quickly as possible. So please let me know if you have questions towards the end. So really quickly, I wanted to talk about the nutritional dual burden paradox. And so this is kind of defined as the coexistence of undernutrition along with overweight, obesity, or diet-related non-communicable diseases. And non-communicable diseases encompass both type 2 diabetes mellitus and cardiovascular disease. And when we talk about the nutritional dual burden paradox, it has also been called like the Hispanic paradox because it's affected quite a bit of Latin American countries where there's kind of rapid development occurring. And so you have both undernutrition in early life and then overnutrition later in life. So it's seen as these two kind of diseases that exist within the same individual, households, or population. So there's a lot of speculation, research, kind of government interest in the dual burden paradox, namely in Maya communities and Indigenous communities located in what's now known as Mexico. And so some of this research has pointed to, ancestry, looking at, oh, this is a fixed genetic thing. And there's been a lot less of the social impacts of diabetes. And and also like what is diabetes as a disease itself. So through my work, I hope to explore more of the social impacts of diabetes and how that the development of these non-communicable disease risks. So metabolic syndrome is really important because it's considered a cluster of risk factors that happen simultaneously before we get to kind of more advanced stages of, say, cardiovascular related diseases, chronic illnesses, and again, diabetes. And there's no exact definition of metabolic syndrome, but I drew this from the American Heart Association. And so it includes, high sugar, low levels of HDL, high triglycerides, high levels of bad cholesterol, and then a large waist circumference. I think abdominal obesity, there's a lot of, it's contentious the way that that's also being defined, but it really just refers to an excess of fat around the midsection, which can lead to pressing on certain organs and affect insulin resistance. And then we have high blood pressure. There's been later studies that have come out that have alluded to maybe including microbiome, like the gut microbiome, and kind of what a healthy gut microbiome would look like, and if that should be included in metabolic syndrome, whether there's more of a certain species of bacteria over another. But I think that is a little bit understudied to really like characterize that. So I do work within a couple of theoretical frameworks, drawing from both Indigenous and non-Indigenous kind of fields. And my approach to trying to understand health in an Indigenous community setting is really relying on Indigenous knowledge systems. And so that comes from a number of different communities. And so Mi'kmaq elder Albert Marshall kind of identified this contention that I deal with, being a Western scholar, but also an Indigenous person and studying and working with Indigenous people. And so two-eyed seeing is kind of described as the best of Indigenous ways of knowing from one eye, and the other eye is the Western ways of knowing, and we use both for the benefit of all. And so I think that's an important kind of approach that I use as I do, this dissertation and community work and all of the above. And so another non-Indigenous Western, kind of Euro-Western framework is the developmental origins of health and disease. And so this posits that, early life exposures, environmental stressors can lead to later life health consequences. And there's also an intergenerational component towards that. And so I think that is an important part of understanding really this like life course approach to the development of disease, both socially and biologically. And so my framing of trying to understand Indigenous health really relies on Indigenous ecological knowledge. And I think if we're going to understand what health is in an Indigenous community, we really need to understand how Indigenous people are thinking about health and what that means. And so for me, I drew from a couple of North American scholars because I'm trained in North American context. And so Indigenous ecological knowledge is often characterized as like a social and cultural paradigm that encompasses a cumulative body of knowledge about Indigenous knowledge systems and their worldviews. And so Anishinaabemowin intelligence was kind of characterized by Leanne Simpson. And I think the reason why I really chose to use her framework is from her concept of ki, which really kind of states that to understand Indigenous health, we must understand not only how people interact with their environment, but how they exist within their own bodies, which encompasses both gender, racialization, identity, and sexuality. And so these are important themes that kind of exist for Indigenous people. And I think really we have to think about it holistically if we're going to understand health. And then the seventh generation Earth Ethic by Patty Lowe, who is at the Center for Native American and Indigenous Research at Northwestern, talks about stewardship of land. And so this also means taking care of land across 7 generations. And this is a very prominent way of thinking for a number of Indigenous communities. And I think this is important in this sort of context and thinking about health and disease, because that intergenerational transmission of both culture is also symbiotic with biological processes. And then similar to Patty Lowe, Vanessa Watts kind of came up with the concept of place thought, which includes creation stories and kind of help people understand their environment. And so I think that is also important and coincides with this intergenerational transmission of culture. And so we are going to move away from Anishinaabe, Ojibwe, like concepts of thought, and move towards Mexico, where I work and where I am from, and my tribe is Chichimeca. So my paternal side is San Luis Potosi, that like really bright green color, and my maternal side is in Jalisco, which is that really bright blue color. And so that's where my family is, and where I work is all the way on the tip in the Yucatan Peninsula. I work with Maya community members, and that's that really pretty red color. And so in Yucatan, there's an 11% increase in diabetes prevalence. So one study reported that over the short span of 40 years, we had a huge jump in obesity and diabetes in rural Maya communities. And these communities experience some of the highest rates of type 2 diabetes compared to non-Indigenous groups in Mexico. And so this is kind of to give an overview of the current burden of disease in these communities. So it is a pressing issue. And so some of the social determinants of health in Yucatan, they often live in extreme poverty, lower than the national average. So this would be in the rural communities compared to kind of people who live in like larger cities. And again, because they're geographically isolated, there's a limited access to education, or there are barriers to education, such as transportation. A lot of folks like don't drive cars, and so the weather's not always the best for riding like a bike or a Vespa or a motorcycle to get to school. So a lot of like young people like don't go to higher education or don't even get the opportunity to get to high school. And again, health clinics in this area are really sparse and spread out and very inaccessible due to their high costs. And then limited healthy food sources that aren't grown. Essentially, if they're not grown, they're really not being transported to the smaller communities. And so in previous studies on the Maya have looked at kind of this phenomenon called coca colonization. And so this actually was coined by French communists where they kind of referred to like the American imperialism and Coca-Cola. So it was kind of in this setting, it refers to the consumption of soft drinks and junk foods introduced by tourism and through neoliberal reform. So providing like tax breaks for people that opened up little shops and sold Coca-Cola in smaller towns. And so this kind of reinforces health inequalities because, you know, you have people who don't necessarily have access to clean water or even running water all of the time, but there's Coca-Cola trucks that will like drive into the communities. So while some researchers have pointed to sugar sweetened beverage consumption as being like very heavily choice, well, I do think that it's certainly a choice in many respects. It's also a forced choice in other contexts. And so one of the things that I'm interested in is how Maya people have relied on or gone back to traditional food sources and practices. And this is something that is kind of sparse in the literature in modern context. So thinking about what has stood the test of colonization and what are people still practicing in terms of their traditional food sources. And of course, thinking about that along with the intergenerational transmission of these cultural dietary practices and the development of these modern diseases. Okay, so I just want to show a map of the current my ethnographic field site. So this is just one, and this is Ekpalam. So it's really in the tippy top of the Yucatan Peninsula. It's a bit rural. It's west of Cancun. So you kind of land at Cancun or Merida Airport, and then you have like a taxi and a bus and then another taxi to get to Ekpalam. So it's in a rural area. And some of the things that I've worked on for the past 7 years now in Ekpalam is really understanding Maya ecological knowledge, so specifically Yucatec Maya ecological knowledge. And that has kind of expanded to include other villages. And I'm looking at how this changes from childhood to adulthood. So I'm looking at retrospective data, speaking to elders and talking about what are some of the ways that you harvested, that you hunted, cooked, cleaned? What did your kitchen look like in your early years? And how has that changed over time? What does that look like now? And my other aim is to assess the relationship between adherence to ecological knowledge and adult metabolic disease risk. So what that means is, how is your lifestyle currently? And I'm looking at whether people are still engaging in these traditional practices, specifically related to diet. And if not, then what has happened to result in these changes? And kind of to look at the relationship between these changes and metabolic disease risks, I'm assessing through biomarker data analysis, looking at health risks. So what are the risks of metabolic disease in the individual and in the population? Okay, so I have done a number of oral history interviews over the span of 7-ish years. I first started in undergrad looking at a project on the native bee species, Malacona beechii, and looking at how people were using that for medicinal purposes. And since then, my research has grown to include a number of traditional medicines and diets. And then I also employ the go-along method. and participant observation. So that involves going with interlocutors to like chop down firewood and work in the fields, cook, clean, basically performing all of their daily tasks with them so that I could understand the body movements as well as what is the repetition, what are important in the day-to-day practices. And then in doing that, I'm learning quite a bit about like cultural consensus and cultural consonance. And I'm also exploring that through one-on-one and group interviews. And basically what my goal is to look at, okay, what is in agreement with what is considered important in the community. So speaking to elders, speaking to kind of their children and looking at, is this something that is in agreement in the community? And if so, what does adherence look like on an individual basis? So kind of gathering patterns of information related to Indigenous knowledge and deciding is this like an individual perspective or is this kind of a group consensus? And so a little bit about Ekbalam specifically and just kind of some history on the Yucatan. So the Yucatan itself didn't really exist in the way that it does now. The Cancun, Tulum destination place really wasn't a thing until the 1950s, 1960s. So I believe dating back to the 1930s, there was interest in developing this area, but it really wasn't until the later half when there was a lot of investment to develop Yucatan specifically for tourism. And so there was mass land dispossession and a lot of displaced, not only Mayan, but other indigenous groups in the Yucatan as well. And so specifically Ekbalam later was reclaimed from an abandoned hacienda. So when the Spanish colonizers came in, they had established this place and put a well, and it was called a hacienda, which is really like a Spanish colonial town. And so displaced families from different towns of Shumil and Cosil petitioned the government and eventually went to Ekbalam and kind of, I say, refounded the pueblo. So there are 26 ejidatarios. So those are the landowners and stakeholders in Ekbalam. And there are about 100 families in non-nuclear. I think in total, maybe around now 500 people in total in Ekbalam. And here is really a community of campesinos or farm workers. So it's a center of huge cultural importance and what different people's, milpas or fields look like really varies. Interestingly, by religion, by kind of their like relationship with the land, what I found, and also engagement with tourism. And so milpas might look a little different depending on how the families are connected. And so this is one quote from a community member who's talking about how the life of a campesino has changed and how they can't live, and they use the word antepasados, but this really means grandparents. And so how they can't live like their grandparents anymore because the milpa doesn't provide enough food to sustain them any longer. And I think this is important because for a number of reasons, but the way that the milpa became changed from a communal land-based system to privatized was through these neoliberal reforms. And I think it was like a ecologist and biologist just kind of came in and came up with a number and divided the land based on this arbitrary number. And so now that families have grown, that number still hasn't changed, and people no longer can grow enough food to feed themselves. And again, don't have a ton of access to different things. And so recent ethnographic interview consists of 31 adults and elders. And what I'm really interested in right now is trying to understand how Indigenous ecological knowledge intersects with access to government programs, and how this determines socioeconomic status in the community. And the reason why I think Indigenous ecological knowledge is so intertwined with access to government programs is because a lot of these programs do affect what is grown on milpas, or like who engages in certain programs and then have to like grow separately and then plant in their milpas. That is one type of initiative. There's another that it attempts to revitalize beekeeping practices and things like that. And so while there are these efforts to kind of maintain these cultural practices or allow people to maintain their cultural practices, not everyone has access, because unless you're a landowner, like you cannot sign up or be involved. And a lot of people need to have documentation as well, which is another barrier. And another problem that I found, or that people are concerned with, are climate change and political turmoil. So that also has affected milpa production. And so there's a lot of like cosmological and like spirituality involved in people's understanding of what political turmoil means and what that looks like. And so this is a picture of entrance to a milpa. So it's a scrubby forest landscape. This is kind of what it looks like. And so the gates kind of mark this like privatization aspect of it, when before it was just really like cultivated fields that everyone just kind of like worked in. And so these are some of my interlocutors, and this is part of the go along method where I perform tasks with them. So here we are spraying for pesticides, and we are pulling weeds in the cornfield. Okay, and this was another task that we did where we looked for, I think in English it's yams. And so I think this was like a particularly interesting part of Indigenous knowledge, because there's a story about how to find yams. And it says, like the saying or like the idea is that when the sun sets is a good time to look for them, because they gather together to gossip. And so then you can kind of find multiple yams growing in the same place because they gather to gossip. And so when I first heard that, I found that really interesting. And then I talked to like this person and that person and that person, and the story was very consistent and very much the same. And so I think there's a lot of these connections that often, are dismissed as like folklore or just a story, but for them, this is kind of a part of their harvesting, their practices, and their kind of like connection and relationships to more than human life. And here are some pictures. So this was in the Pueblo of Hunuku. So it's situated very, very closely to Ekbalam. And so there are some signs of oregano and then the uses for what ailments. So this one says, okay, oregano can be used for ear pain. It could be used as a condiment. And so there's, I think I was asked before, like, who are these signs for? And for me, because they're written in Spanish, it could signify that these are for potentially tourists. It could be that it's um, for the locals, or it could be that someone just really liked to share some of their knowledge. And so I think this is kind of like an interesting aspect of like medicinal knowledge that I think people are um, kind of showing and sharing. And so this one is aloe vera, and this is specifically states that it's just used for diabetes. And so again, I think what I'm investigating is really the specifics of, okay, it's used for diabetes, but what is the process that goes into it? Whether that's in tea form, whether it's eaten, whether it's raw, etc. And so this is Sakbekan. This is a Mayan, written in Mayan, and it's just for headaches. And so this plant is called tacanil, and this plant is specifically used to regulate blood sugar amongst many of the women and also men in the community. But I was specifically tasked to go and find this plant and bring it back because one of my interlocutors had high blood sugar. And so I think this is another form of understanding like medicinal uses of how people are combating modern day illnesses. Okay, and then this is mint, and this is used for diarrhea and specifically, and this was actually very effective because I got sick many times and they made me this and it cleared me right up, which might be TMI, but the stuff really works. And so just a little bit of more context in the community. So there are 13 ejidatarios who participate in the cabañas, which is this was a grant funded initiative, like eco-tourist initiative in the community. And so cabañas are really like a bunch of kind of small, like palm thatch structures that are like in the form of a hotel. So it serves as like an eco-tourist hotel in Ekbalam. And there are 17 ejidatarios in the Sembrando Vida project, and I'll kind of show what this looks like. And then again, people who don't have landowning status can't participate. And there's another program called Adultos Mayores, and that's a case-by-case basis. And that's a pension program for the elderly. And so these are what the cabañas look like. So people who are involved in the cabaña projects have a really interesting relationship to Indigenous knowledge because it kind of weaves together both traditional practices, but making it palatable for tourism. And so this is another picture of the entrance of the cabaña, the hotel. And so this is Sembrando Vida. And essentially, Sembrando Vida is a government program where they will give seeds for people to plant in this type of area, general areas. This is a common space. And so people will plant like mango trees or different types of like whatever they are told to plant essentially. And they grow them here and then they take them to their milpa and plant them there. And somebody from the organization will go to the milpas and look at what they've planted and then pay them based on that. And then here's some other kind of what that looks like. And so one of the things that I hope to achieve from this project and understanding kind of the complexities between access to certain things, Indigenous knowledge, and health is it encompasses a multi-scaled, broader impact approach. So I think on the individual level, that means having a research team from locals in the community and participants, which I do, and I'm like, I love them and I'm very grateful for them. And so I now have three community members who are also, helping me with my dissertation. I in turn train them and pay them on their kind of thesis projects because they're all college students, which is great. And so they're all from Ekbalam. And then at the community level, really providing services to Ekbalam, Santa Rita, and Actunco, which are smaller pueblos. And so what I hope to do is provide point of care health results that are often inaccessible. So point of care, really what that means is I take a minimally invasive blood prick and I give immediate health results to individuals and give them recommendation for follow-ups to clinics. And once I have, population level information, I will give that information back and really try and help people understand what health looks like, not only for them individually, but as a community level. And eventually, I hope to really push researchers and kind of the broader public health community to understand health policy implications and how, if you're trying to understand health in the Indigenous community, we really need to incorporate Indigenous perspectives and make sure that those are really grounded in Indigenous knowledge systems. And so one of my broader impact initiatives includes cleaning this clinic. And so this was the state of the clinic. I'm not going to play the video, but this is kind of what it looked like. I don't have after pictures, but we did manage to clean all of this up. And so this was a clinic that was abandoned in Ekbalam, I believe 5 years ago. So there's a lot of, every 3 years, there's a shift in who the mayor is and the kind of president of the municipal. And so also in times of that change and then government funding being cut, there was no longer any support for the clinic. And so this was kind of the state that it was left in. And so what I hope to do is fix this clinic and use this as a neutral space so that doctors and nurses who are traveling can come and provide health care and medicine to the local community. And so this was another broader impact that I was not directly involved in, but I was an undergraduate and kind of saw this project take shape. And so this is a maliponario. So this is the native stingless beekeeping of the Melliponaceae. And so this is like a centuries old practice that is written about in the Maya codices. And this project was successful in some ways and not in others. I think having it kind of in the far edge of town was a little bit of a challenge for many people. But for Doña Lupe, this project was a huge success, and she adores her bees, loves her bees, and also uses them for medicinal purposes, and just has a wealth of knowledge of beekeeping. And so her grandparents, or her uncle, I believe her great uncle, was a Melipona beekeeper. And during the time of the shifts where they had left their community, beekeeping was no longer a flourishing practice anymore due to a number of reasons, whether it was colony collapse, bees fleeing, or simply people had to leave their milpas and weren't able to like care for them in the same way. And so Doña Lupe has very fond memories of her childhood and knowledge of beekeeping. And so now, you know, in her later stage, she's able to keep them again. Later stage, it's kind of like a weird way of saying, you know, she's not a kid anymore. So yeah. And these are the pictures of the stingless bees and the honey. And Doña Lupe makes amazing soap out of them. And so she's able to actually produce some income. Very little, but she makes medicinal soap that's used for like rashes and skin abrasions and such. And so this is another kind of government program initiative. And so these are a store. There's only one of these types of stores in Ekbalam. And so this will have like goods for community members, eggs, onions, like very simple produce. And I think, you know, what's interesting is that there's 3 other stores that sell chips and Coke, but only one that really focuses on trying to get like healthy foodstuffs in the community. And so this is owned by one of the landowners. So I just wanted to kind of include that there's something there. And I know it seems like we're jumping from one thing to another, but I think nixtamal is like one of the examples of the food stuff that is really, really a staple in the community and has become really expensive to try and get. So nixtamal, not necessarily nixtamal, but maize is used to make nixtamal, which is treated with lime, cooked and ground to produce flour to make tortillas, which is, I think, one of the biggest things that people eat in the community. And so here's some pictures of some tortillas that I made. And I wanted to share this picture because this encompasses everything that is in this picture came from the milpa or came from a person's home. And so this is, to me, a really nice example of Indigenous knowledge and that being brought to life in one food. And so you have kind of the, you know, the chaya, the banana leaf, the egg from the chickens that they raised. You have the tomato that, you know, they sourced, and you have the nixtamal that was used to create the tamal. And so there's a lot of stories that goes into every meal, and a lot of labor that goes into creating something. And this is from an Indigenous perspective, an Indigenous recipe, and is a Maya meal. And so some future directions for this work is to further support the clinic restoration project, and then to work with other communities to assess the burden of metabolic syndrome. And again, kind of more succinctly determine what is the cultural consensus in addition to Indigenous social determinants of health. So I'm really hoping to narrow in on cultural foods and practices, and eventually develop kind of a scale that encompasses Indigenous knowledge systems from a Maya perspective to understand what adherence means and looks like. Okay, thank you.
Great. Thanks so much, Bobbie. Really appreciate it. I'm wondering if there are any questions for Bobbie. We'll need to have an after photo of the clinic cleanup at some point. Yeah, if you have any questions, feel free to put it in the chat. I can go ahead and start. Bobbie, I'm just wondering, I know this is a work in progress, and there's a lot of years of research that have gone into this. I'm wondering, based on the aims that you've put forward, what you hypothesize the relationship between greater level adherence to Indigenous knowledge practices around dietary and cultural practices are in relation to Met-S health risks?
Yeah, and so one of the reasons why I use the word access a lot is because um, there's a really big distinction between who has a wealth of knowledge about Indigenous system and who can actually adhere. Um, and I think, land ownership is a huge one. And what I've already found already is that for individuals who are more engaged with tourism, they may have a wealth of Indigenous knowledge and be part of this, consensus, but do not have that adherence element and do in fact have higher rates of metabolic risks. Have a lot of self-reported data to suggest that. And so one thing that I found is that folks who are more situated within tourism, not all, but some will tend to have higher risks of metabolic related health outcomes.
And is this in relation to activity levels or dietary practices, or maybe like psychosocial stress due to changing cultural expectations, or what have you seen so far?
All of the above. all of the above. I think folks who engage with tourism more often experience more discrimination from when I've spoken to them. Activity level is a huge one. I mean, this still involves like walking, going to the archaeological site that's like 300 feet away, or doing tours, walking people around the pueblo, but it's not nearly as intensive as growing food and harvesting and any of that. And again, because you're engaging with tourism, you're kind of out of the house a lot and you're not eating at home as often. So people are really eating like fast foods, meaning it's just like foods that's like quick. Instead of like sitting down and having those meals. But there are some families who will send kids to take home cooked meals to where they're working. So it really just depends.
Other questions for Bobbie? Cool. Bobbie, what are you, oh, let's see, we have one quick question from Frida. Frida, do you want to read out your question, or I can go ahead and read it for you?
Sure, I can read it. You mentioned there's 3 stores in Ekbalam, with one of them being a government-sponsored one with basic produce and 2 stocking soda and chips. Could you share more about the food environment? Like, are there fast food restaurants in for tourists, or how does it look like?
There's not a single restaurant in Ekbalam. There's no money to have a restaurant. Nobody has the capacity to sell food, and it's a really, really small community. So if people want to get fast food has a different meaning in this context. It's not necessarily like, processed or like junky. It's more so like meat heavy, or like they'll buy meat from like a different town and bring it in, and that's considered like a fast food because it's not like meat that was like coming from the milpa or coming from their animals or their chickens. But for the most part, like people would have to travel a minimum like 20 to 30 minutes in a car or taxi or on the motorcycle to have access to like a pizza or something. So yeah, that's kind of what the food environment looks like. There's these OXXO stores, which I think would have like the fast food, which is like canned stuff, cheese. People don't have refrigerators there. And so that's how people would access that.
Thank you.
Cool. So Nerly has a question. I'm going to read it out for her since she's in that loud area. She says, "Hi, Bobbie. Thank you for such a wonderful talk. Could you please talk more about the relationship with your communities you work with and local health providers? Thank you."
Yeah, so this is actually a very interesting relationship. People are often who come to Ekbalam or that were there when the clinic was there would be traveling or like missionaries. So those were the people who were actually providing a portion of the healthcare because it was free, are very accessible because they would come to the town. So if people are sick or kind of need to go to the doctors, they'll try and do whatever they can to mitigate that at home first, and then they'll travel to the town of Temoson. So you have to take a taxi to Temoson. And if it's a really serious condition, they would travel to Valladolid, where there's a small hospital. So I think a lot of people's experience with healthcare providers is very, very costly because of them needing to pay for a taxi, a round trip taxi. It's not at all cheap. And then I think people have experienced being turned away because they're too sick or suffer from discrimination because they're racialized as Maya people. Or again, there's a language barrier because a lot of the like elders only speak Yucatec Mayan. And so I think, you know, through my interviews with them and my like very limited understanding of Yucatec Mayan, they've kind of expressed like there being such a huge communication barrier when they do seek care.
Cool. Okay, and in the remaining few minutes, I'm wondering if you can answer one question just about how you came to entering a PhD program. So I'm wondering if you can talk about basically how you decided to go from you know, your undergrad institution, which I know essentially did not start at CSU Long, you know, San Bernardino, Dominguez Hills. How you decided to go from, you know, your previous educational background from doing nursing to doing other types of work to biological anthropology, and you know, finding Maya village. How did you decide to eventually, you know, make the decision to pursue an academic degree?
Yeah, so I started out in nursing at Long Beach City College. I was 17 when I started college because I graduated high school early. So I was like, I mean, who makes big decisions at 17? I was just like, all right, like I'll just be a nurse. So I went to community college, which is a really strong program for that. And then little by little, I started taking, you know, bioanth classes and decided when I transferred to major in that in biological anthropology, but I was still very heavily in the anatomy kind of biology realm. And in my so I didn't even know what a PhD was or like a master's or anything. And then in my undergrad, I applied for an internship at the Smithsonian and got it. So like did work on periodontal disease in Paleo Native American remains. And so I was working with those ancestors. And I don't know, that kind of really opened my eyes to like biological anthropology, things that I can do with it, how I can serve Indigenous community members by being in a PhD program. And so a way that I kind of like stumbled upon my community members. I know I wanted to work in Mexico. I was like, why don't I just work with my tribe? And I was like, no, that's kind of messy. So I did this like research. I had this research opportunity and I went to go study the bee project as an undergrad. And then I took time off. So I worked for a nonprofit before applying for my PhD. And I decided that, you know, if I was going to do my PhD, that I didn't want to be anywhere but Ekbalam. And so I had community first and then decided to do the PhD after. And so that's how I ended up, you know, kind of that route was really just like, how can I use these people's money to like serve the community and other Indigenous communities, essentially.
Great. Well, thanks so much for your talk and sharing your work. We really appreciate it. And thanks so much for everyone for attending, not just this seminar, but also the past, like 10 or something. Yeah, there was a lot of wealth of knowledge that's been shared these past several months. So we really appreciate everyone's participation and hope we've learned something, at least one thing per week. But thanks so much, everyone. We really appreciate it. If you have any questions about the speaker series or getting involved in biological anthropology or anything that's been discussed in the past few months, please feel free to get in touch. Hope everyone enjoys the rest of their day and the rest of the summer. Great, thanks so much, and thanks again, Bobbie, for your work.